Hi everyone, welcome. So Anuja's already done an introduction. There was just one thing I wanted to pick up on in the introduction as well. The project that I did at the West Midlands-based Prison, I did complete it 2 years ago. I think, Anuja, I'd probably hadn't updated my biography, so apologies. So yeah, at the moment, I'm working for the Centre of Expertise on Child Sexual Abuse. So I left academia 6 months ago and joined the CSA Centre. So this presentation, the main focus is to draw out and discuss the key findings from my PhD research, which was published in 2018. However, as I'm also part of the CSA Centre, this will be something of a hybrid presentation. Okay, so this is just a really quick note on self-care. I don't want to dwell too much on this because I know Anuja's already kind of covered this, but as we know, obviously, it can be very difficult to think and talk about sexual abuse. So it's important that we're just kind of considerate of the feelings and experiences of everyone present here today, being kind to ourselves, both personally and professionally, and respecting each other's learning journey as well. Okay, so in terms of what I'll be covering in today's presentation, so it is a lot to kind of fit into this 20-minute slot, but I will try my best to keep to the time. I'll firstly introduce the CSA Centre, which is where I currently work. So just discuss what we currently do at the centre, and also then go on to discuss the research that we've done in this space and the current project that we're working on. And then the crux of this presentation is to discuss what the key findings were from my own PhD research on British Asian men's experiences of child sexual abuse. And then I'll end the presentation by signposting you to some of the work that we've done and we're currently doing at the CSA Centre. Okay, so just to give you an introduction to our centre initially. Okay, so you may or may not have heard of the CSA Centre. If you haven't, then please do look us up. And hopefully you'll find plenty of resources and research that might be useful for your own practice or research, or just generally, if you have an interest in this area, you might find our resources really useful. So we're the Centre of Expertise on Child Sexual Abuse, commonly referred to as the CSA Centre. So we were established in 2017 and operate across England and Wales, with the aim of reducing the impact of child sexual abuse through improved prevention and better response. And we do this through 3 streams of work, which are research, training and practice improvement. So my kind of position at the centre is a research and evaluation officer. So as I said before, I joined 6 months ago, and prior to this I was a lecturer and researcher and worked across a number of different universities. So we're a multidisciplinary team at the centre, and we work very closely with key partners across a range of different sectors, including healthcare, the criminal justice system, education, local authorities, academic institutions, and the voluntary sector as well. So in terms of the research that our centre has done in the past in this space, so in 2021, we commissioned the Race Equality Foundation to carry out this piece of work for us, to kind of investigate how we could improve responses to child sexual abuse in Black, Asian and minoritized communities. So this project involved interviewing 16 professionals working across the voluntary sector and local authorities to try to gauge their views on what the needs are of children from these communities, whether those needs are being addressed, and how service responses could be improved towards these communities. So all interviewees had some kind of experience or expertise in working with diverse communities. And some of the recommendations that came out of this report included increasing diversity within the workforce, addressing racism and unconscious bias, developing cultural competency in the workplace, establishing services within communities and building trust, raising awareness of child sexual abuse within communities, so at a very grassroots level, and challenging ideas that prevent disclosure and encourage victim blaming. So I won't go into any more depth on this report, but if you go onto our website, you can download the full report if you're interested in reading it. So kind of as a continuation of this, we've started a new project that seeks to identify the gaps and priorities in research of child sexual abuse in Black and Asian communities specifically. So with this particular project, we're doing this in partnership with the Bernardo Center for Children and Young People of African, Asian and Caribbean Heritage. And it's being carried out by an externally commissioned researcher based at London Metropolitan University's Kwazu unit, which is Dr. Sukwant Dhaliwal. So the aims of this particular project are to provide an overview of published research and of research that's currently underway in relation to the identification and response to child sexual abuse of Black and Asian children and young people, and this includes adult survivors of child sexual abuse as well, to assess the quality of this research that's being conducted, and to try to identify the most important evidence gaps in knowledge on this area. And this is kind of what the discussion will focus on as well after this presentation. So we hope to share the findings of this particular project, which will be in the form of a report early next year. Okay, so now I'm going to move on to discussing what the key findings are from my own PhD research. Okay, so just to give you a little bit of background and context to this, I know Venetia's already kind of discussed this in quite a lot of depth. So South Asian communities have had quite a long-standing presence in the UK, mainly as a result of post-1947 migration and then a second wave of migration that we had in the 1960s. And they make up around half of the ethnic minority population in England and Wales. So despite the very well established body of research that we have on child sexual abuse in Asian and other minoritized communities has received relatively little research attention in comparison. So the early research that we have that looked at child sexual abuse in Asian communities really explored the kind of impact on racism and on disclosure and help seeking, and also attempted to dispel myths around the nature and existence of sexual abuse in Asian communities on the basis of assumptions around culture and religion. However, of the literature that does currently exist, there is a general consensus that disclosures of child sexual abuse occur less frequently in Asian communities, and that disclosure in Asian communities is compounded by additional barriers around shame and honour. Another kind of issue that needs highlighting here as well is that there's very little qualitative research that's explored the experiences of male survivors of child sexual abuse in the UK. Most of the work in this area kind of continues to emerge from the US, which means that we have a very limited understanding of the experiences of male victim survivors in the UK, and even less so about the experiences of minoritized men. So most of the research that we do have in this space has focused exclusively on the experiences of Asian women and girls. So in terms of the research design that I adopted for my PhD, I'm going to focus on one element of this. So there were 3 phases. So I conducted 6 semi-structured interviews with counsellors who'd worked with Asian male victim survivors of child sexual abuse. I also carried out 2 focus groups with British Asian men and women to gauge kind of broader views around their perceptions of child sexual abuse across Asian communities. And the part that I'm going to focus on for this presentation are the semi-structured interviews that I carried out with 8 British men of South Asian heritage who had experienced child sexual abuse. So all of the men were adult survivors and had Indian, Pakistani, Tamil or Bangladeshi heritage. So in terms of the key findings, there were several themes that emerged during the analysis of these interviews with the 8 men. And you can see these overarching themes along the top of the table, which are in the kind of darker green boxes. And then beneath those, you have kind of several sub-themes that are located within each of these overarching themes. So the first of these themes that I'm going to discuss is around disclosure of child sexual abuse. So one of the things that emerged during the interviews was that a major challenge for the men was to tell somebody that they had been abused. So all but one of the men, so that's 7 of the men, had disclosed during adulthood, and 3 of the 8 men had told their mothers that they'd been abused, 2 of whom had very kind of negative and unsupportive reactions from their mothers. So the men that had told their moms that they'd been abused described in a lot of kind of detail how this had a really lasting and visceral impact on them. And closely linked to this was this idea that as male victims within an Asian family, that they'd be letting the rest of the family down in some way if the abuse was to come to light. So this included, for example, breaking family ties if the abuser was part of the family or wider family unit. And also kind of more broadly around the gendered expectations of them as men to be quite stoic or to fight back if they were subjected to kind of any violence and harm. The other sub-theme to emerge was a deep-seated fear that they wouldn't be believed. And so most of the men chose not to tell a parent. And this was kind of compounded further by the fact that most of the men that had taken part had been subjected to intrafamilial child sexual abuse and therefore had kind of additional fears around the breakdown of family relationships. The men were also very fearful of being outcast or ostracized from the family. And for some of the men that I'd interviewed, this was very much the case. The research also indicated that all of the men felt the abuse was kind of an attack on their masculinity, and that identifying as a victim of child sexual abuse would contribute towards a loss of this so-called kind of masculine identity. Some of the men also discussed how this was linked to their sexuality or perceived sexuality, with a fear that male-on-male child sexual abuse would be misconstrued as something that was consensual. This was often kind of spoken about in conjunction with the wider homophobic attitudes that still exist within Asian communities, which can be quite a huge barrier to disclosure for male survivors of child sexual abuse, but particularly so in Asian communities because of this pervasive homophobia. In terms of culture, many of the men articulated how it was really difficult to kind of untangle the secrecy around the abuse from their culture. So shame and honour in particular not only kind of prevented them from telling family members about the abuse, but also prevented many of them from reporting the abuse to the police as well. So some of the men discussed how kind of the entire experience around the abuse had changed how they felt about their own culture, and in some cases how it made them feel about their religion as well. All of the survivors interviewed were engaged or had been engaged in counselling at some point in their life. So this was another kind of theme to emerge from the research interviews. And all of the men had very kind of positive experiences of counselling in terms of how it had improved their mental health and well-being in the aftermath of the abuse. And for a lot of the men, they felt that the counselling was actually much more conducive to their well-being than their kind of family and friend networks had been. The other issue that was explored during the research was whether ethnic differences between the counsellor and the survivor had impacted on that relationship. I felt this was quite important to explore just because, you know, a lot of the literature talks about kind of ethnic matching within a counselling context. For the men, this was quite mixed, what their kind of responses were. So some of the men expressed that they had difficulties in terms of articulating to a white counsellor, for example, some of the wider issues around their culture. So explaining, for example, what honour means. So we know, for example, that honour, I mean, the word honour, obviously, this is a kind of English translation of, of the term that we actually use across Asian communities. So it was very difficult for them to kind of really fully articulate what honour meant, and how important it is to kind of uphold honour within Asian families and communities. And what the ramifications of honour are as well, if honour is kind of seen to be compromised. Another kind of issue that they spoke about was shame as well. And again, I think we don't really do it justice when we just talk about it as honour and shame. We really have to kind of delve down into what it actually means within, an Asian context. And I know that Venetia's already spoken about this in great, a lot of depth, so I'm not going to go too much into it. But for a lot of the men, within the context of these counselling relationships, they felt that it wasn't always kind of possible to articulate how kind of deep-seated this notion of shame was within their family, and how shame doesn't just kind of apply at an individual level, but it does also apply for the wider family as well. So if, for example, something like child sexual abuse was to become public knowledge, or to kind of leave the family circle, then that kind of subsequent shame that would be brought upon the family. So in terms of some of the kind of recommendations that came out of this research, if we kind of look at the problem through an intersectional lens, and how the kind of facets of a person's identity can impact on their experience of abuse and how it's responded to, this can really be useful in both the kind of research and practice context. So there is a real kind of great need for an intersectional approach to try to understand the experiences of Asian and other minoritized victim survivors of child sexual abuse. We know very little in general about Asian and other minoritized people's experiences of counselling and psychotherapy. So it would be useful to have more research in this space as well that delves a little bit deeper into people's Asian and minoritized people's experiences of counselling, and what their kind of specific needs are. There are very few evaluations of service responses to child sexual abuse in Asian and other minoritized communities. So evaluating service responses would give us a better indication of what's needed to improve and enhance service delivery for specific groups, particularly marginalised groups. We need much more research to try to understand the needs of men, particularly who wish to report abuse to the police, and their specific needs as well when accessing the criminal justice system. So this isn't just kind of necessarily for minoritized men, but men in general who experience child sexual abuse. And lastly, we know very little about the nature and extent of child sexual abuse in Asian and other minoritized communities. So if we have kind of better statistics on this, it would be useful in terms of contributing to our understanding of child sexual abuse in minoritized communities. Okay, so I am going to plug my forthcoming book. So this is an edited collection that I've done alongside Professor Aisha Gill, who's done a lot of work in this space already. So this collection is due to be released, I believe, next month, so in December. It can be pre-ordered on Waterstone's website and Amazon as well. So it's an edited collection. And it brings together multidisciplinary expertise from researchers and practitioners around the world, including Venetia, who has a chapter in this book, I'm really proud to say. And the kind of purpose of the book is to try to better understand child sexual abuse in Black and racially minoritized communities, and to provide recommendations to improve legal policy and practice responses as well. So please do look out for that. That will be released in the next month or so. And just to signpost you on to some of the work that we've done at the CSA Centre, we have lots of resources that we have produced that have been really useful for practitioners and researchers. So we have, for example, our signs and indicators, resource, Communicating with Children, which we did earlier this year, and our guidance for professionals working with sexually abused children, which is How to Support Parents and Carers. So we have a very diverse range of resources that you can access for free on our website. We also have some key messages from research papers. These are really kind of succinct, relevant information for frontline practitioners and commissioners, and include up-to-date research combined with guidance supporting confident provision of the best possible responses in one accessible overview. So these are really kind of short documents that summarise research in particular areas. So for example, we've got one on harmful sexual behaviour, institutional child sexual abuse, and we have other key messages coming up as well later next year. So please do try to have a look at those as well. We also, lastly, have a newsletter as well that you can sign up to, which will keep you up to date on the latest research on child sexual abuse, practice guidance, including some of the documents that we've produced and published. And then we also have a really useful blog that's linked on the newsletter as well. And lastly, if you are affected by anything that we've discussed today, and I know that Anuja and the team have already said this already, there are obviously different services that you can contact if you are affected by anything. Okay, thank you.